Has this ever happened to you? Well, hello, Walter Smith. Thank you for coming today. How you doing?
I'm doing mighty fine today, thank you.
Great. Yeah, that's awesome. Well, your lab results came in, and it seems that you have type 2 diabetes.
What's diabetes?
Well, diabetes is an acute complication that can include diabetic ketoacidosis, hypersmolar hyperglycemic state or death, serious long-term complications including cardiovascular disease, stroke, chronic disease. In diabetes mellitus type 1, there's low levels of induced loss of insulin, blood glucose beta cells in the pancreas, diagnosed with glucose, oral glucose tests, tolerance tests for glycemic hemoglobin A1.
Okay, wait. Talk about information overload. Hi, med students. This video is targeted to you. So the topic of today's video is medical jargon. We're going to go over why medical jargon is so dangerous and what you can do about it. Jargon is defined as the technical terminology or characteristic idiom of a special activity or group, which in this case is medicine. Words like arrhythmia, cardiomyopathy, diuretic, hypertension, respiration, and nephrology can do more harm than good. You'll just end up confusing your patient.
If patients can't understand what you're saying, this can cause lower patient adherence, lower positive health outcomes, lower efficacy of care, and a greater chance of lawsuits that fall upon the physician. Now that wouldn't be fun, now would it? Now, I had the opportunity to talk to some med students to see what they know.
So I called up my friend.
Jeremy Taylor, third-year medical student, class of 2019.
Are you aware of any of the health issues surrounding patients' health literacy?
Somewhat. I would say, yeah, to some extent.
Is there a class where they teach you how to talk with patients?
We do have like this longitudinal class through first and second year called Intro to Clinical Medicine, 1, 2, 3, and 4.
Is there a focus on health literacy?
We have had that topic touched on in a couple lectures. I don't remember a lecture like focused purely on that topic, but there's definitely been, it's sprinkled across the 2 years, multiple classes.
Do you know how would you determine a person's health literacy?
How to determine health literacy that I'm aware of? I don't know of any specific named tests or any specific protocol.
Okay, now I'm just gonna name some tests. I just want to see if you've heard of them, okay? The smog test.
The smog test, no.
The realm.
No.
The close.
No.
NVS.
No.
Kleinman's.
That one sounds familiar, but probably say no.
Sills.
No.
Chew.
No.
TOFLA.
No.
PMAT.
No.
Or SAM.
No.
Now, do you think there should be a greater emphasis on health literacy in med school?
Yeah, there's probably room for some more focus on that, because now that I think about it, I've only been in the clinics for 3 months at this point, but I haven't one time yet tested a patient's health literacy or kind of investigated it. For something like that, there should be a standardized kind of test or way to go about it, because there's tons of those for other things, screening anxiety, depression, just all kinds of things. So
now it seems like a lot of med students want to learn more about health literacy, medical jargon, and how to talk to their patients better. Here's what you can do about it.
So you've probably spent most of your life learning about medicine and the vocabulary that comes along with it. But be aware that most of your patients most likely do not share the same training. Most likely. When talking to your patients, you need to use plain language, and you should be clear and simple. So here's some more tips. Use explicit instructions when explaining how to do something. Use simple, specific, and direct sentences when speaking to patients. Make sure any new words are clearly defined. And be aware that most of your patients will have a 6th to 8th grade reading level. Also consider using the teach-back method. It's a communication confirmation method to make sure that your patient understands. So if the patient understands, they'll be able to teach back the information accurately. Now if you put it all together, it should look something like this.
You have type 2 diabetes.
What's diabetes?
This means your body doesn't process the sugar you eat normally. And this can have serious effects on your health. To manage your diabetes, you will need to take something called insulin throughout the day. Exercise and eating right can also help.
Thanks, Doc. That was really helpful.
No problem. Have a great day. You stay there. Now go forth and use your knowledge to improve health literacy and healthcare around the world. The end.
Directed and edited by Justin Lee. Starring Hunter as low literacy patient. and Morgan as camera person, and Ori as everything else. Script and research done by everyone. Some more credits.